really pleased to introduce Dr. Linda Brubaker. And probably the most important thing before I give you the highlights of her CV is that she is a wonderful colleague, mentor, sponsor, and has been a true friend of this department and most certainly of mine. Linda, we're thrilled you're here. Now, Linda works the FMRS division at University of California, San Diego, but that just does not say it all. She's been the interim chair there for quite a bit of time, and they have just recruited a new chair. And prior to that, she was dean at the Loyola University Chicago Stritch School of Medicine for greater than 6 years. While she was there, she built a great division of urogynecology, and she has greater than 360 publications. She's very well funded by the NIH. She's a PI on a big grant from the NIDDK. And you can't list her awards, there's just too many. And just to wrap it up, she's one of the associate editors of JAMA. And I just thank you so much for being here so early on California time. We're so pleased to see you and happy to hear from you too.
Laurel, how kind, and thank you. And I know it's early there too for people. So, but we're academic people, so we're used to a little bit of an early schedule, or we somehow force our way into it. But it's really an honor to be invited to join you today. I'm sorry we can't be together in person, but this is what we live with these days. We'll do the best we can with Zoom. I will keep an eye on the chat as we go, and I encourage you to put some comments in chat to encourage others or respond to what we're talking about. And before I get started, I want to just make a shout out to Erica, Melissa, Stephanie, and Emily, because compared to everyone else in the audience, it's especially hard for them to pay attention to what I'm going to say because they're still rehearsing their presentation in their mind. And it's a big day for them, and we're really looking forward to their presentations, which I think are the key things of the day. So what we're going to talk about today is everyday scholarship. We all either work or have elected to train in an academic setting. So one of our jobs and one of our callings is to create and share new knowledge. And how do we do that? How do we keep that scholarship light shining bright and pass on that flame of intellectual inquiry in our world? So we'll talk a little bit about how that happens and why some people are able to do that apparently with pretty good ease, and others have some challenges around that. I'll go through the required disclosure slide. My disclosures are limited to those related to my editorial roles. As Dr. Rice mentioned, associate editor for JAMA, I'm the editor-in-chief for our subspecialty journal, Female Pelvic Medicine and Reconstructive Surgery, nicknamed the Gold Journal because it sets the gold standard for publication in our subspecialty. And I'm the subspecialty editor for Up to Date for our field. So why do we even think about scholarship? Well, part of this you should think about as a self-preservation, because we know people who are engaged in scholarship have healthier brains, and it protects them from professional burnout. So people who are doing scholarship use the 100% of their brain that we're all intended to use, and it keeps your brain healthy to learn new things, think about new things, challenge your ideas, and we'll talk about how to challenge those ideas in a little bit more detail. I mentioned the prevention of burnout, moral distress, professional fatigue, whatever we call it. It's a very real phenomenon in this day and time. And the electronic medical record is generally, you don't feel better after you've spent a couple hours with the EMR. And so having something that can lift your professional spirits is important. And then there's a moral and ethical obligation to others, our patients, our colleagues, and the world, really, that we have been given the privilege of a medical education, and it's our vocation, it's our calling, it's time to give back and also pay it forward to our trainees. That being said, it is much more important to have an outstanding life than an outstanding CV. I have yet to see a tombstone or a funeral brochure that lists anybody's CV. It just doesn't happen. So your scholarship is an important part of your professional life, but it's not who you are. And we'll try to talk about why that needs to stay separate and unique. When people are beginning to think about how scholarship will be part of their professional life, they often feel very protective of ideas, like as if there's only one good research idea. There's a million research good ideas. We could spend the rest of the day brainstorming, the rest of the month brainstorming, the rest of the year brainstorming, and we still wouldn't run out of really good research ideas. So train your brain to think broadly, question everything. And of the questions you come up with, we'll throw away about 9 of them, but that 10th one will be a gem that we can work with. And don't be afraid of that process. Generate ideas, generate ideas, generate ideas, and then go through that refinement process. It's amazing. It's 2021 and we still don't know what causes labor. I wouldn't recommend that you tackle this as a resident project necessarily. If this was an easy one to figure out, someone would have done it by now. But it's amazing that we still don't know what causes labor in humans. What's the evidence for our current postpartum practices? Why do we see people after delivery at 6 weeks? Isn't there other things that go on for a year? If breastfeeding is so important, why don't we check in on people who are breastfeeding? Simple, common things that are amenable to resident level scholarship projects. So those of you who are going to be in this forum next year, if you haven't selected your projects yet, begin to think about some of these common things that you see frequently. The world of human microbiome, one of my research interests, has absolutely exploded over the last decade. And you are probably following the ongoing debate about is the placental sterile or not. But we don't know a lot about the human microbiome in Ob-Gyn, and there's a lot that we could learn. So many different areas that we could begin to question and do scholarship in. Scholarship's not a competition. I mean, yeah, sometimes a day like today, somebody's going to get a little award or a little treat or something like that. But in the big picture, it's not a competition. My husband does not love me anymore. I'm not even sure he knows what NIDDK is, really. It doesn't really matter in the big picture of life. It's not a competition. It's, think of it as a world of abundance. So there are unlimited scholarly activities. And just because I'm giving this talk today doesn't mean that someone else can't be giving a talk somewhere else. Lots of opportunities for research. Everybody can be involved. Lots of opportunities for writing, lots of opportunities for teaching. And it's your job to find your sweet spot for how you want to engage with these different scholarship activities in your own life. We've talked about that there's unlimited research questions. And one of the things that's important as you tackle a research question is learn to multitask and stretch those scholarly efforts. For example, if you're asked to do a M&M conference, and so you kind of research a less common presentation of such and such, take a look at the literature. Is there an up-to-date review on that topic? You're going to be reviewing the literature anyway. Is that something you could write up and put into the literature to help others? If you're giving the grand rounds presentation, is that something that you can repurpose that work and have a little additional dissemination effort out of that? So think about how you can do that. And some of the mentors in your department are outstanding at doing this, and feel free to reach out to them or others on how you do this effectively so that you get the most mileage out of each scholarly activity you undertake. Well, I want to start by talking about your inclination. So this is really kind of looking into your heart and your scholarly soul. You really have to kind of know yourself. You're in an academic institution. I'm talking to a room full of really bright people. And there's the socially desirable you, and then there's the really you. And you have to just understand, you all know how to play the game. You all knew what you had to put in your medical school applications. You all knew how to compete appropriately for residency or your faculty positions. So everybody knows how to do those things, but you got to know your heart. So when we're having journal club or a presentation like this, no offense taken, you just maybe can't wait till it's over, right? Like, please, I hate journal club. I hate talking about these things. Why do we have to do this? I'd rather just read about it. Can't you just tell me what the study found? Should I give drug A or drug B? And by the way, what should I make for dinner? And where am I going to go on my next vacation? Your mind's a million miles away. That's not a right or wrong. Just know if that's you, don't go there then, right? Because you're not inclined in that way. Or you really find like, well, that's interesting. I wonder why they did that study. I wonder why they didn't ask about B instead of C or C instead of D. Huh, that's interesting. Now, I really like the way that, Emily presented that paper. I might have done a little bit differently, but the way she did it, that's interesting. The way we've done journal clubs hasn't changed in 100 years. Perhaps we could, I wonder if we could do something different. Some people are doing that on tweetorials or tweet chats, like our journal, check it out. But anyway, so if your mind is going over there, maybe you're more inclined to scholarly activities. So be honest about your assessment, because at some point in your career, you don't have to say things that you don't actually mean anymore. You landed the interview, you landed the job, you're there. Now it's your job to create your professional life. And this is important. This is one of my favorite sayings from Stephen R. Covey, who wrote a fantastic book that I consider required reading for everyone. It's called 7 Habits of Highly Effective People. It's an old book. It's now out in its second edition. But this quote, if the ladder is not leaning against the right wall, every step we take just gets us to the wrong place faster. So if you don't have inclination for certain scholarly activities, stop climbing up that ladder. Put the ladder somewhere else. It could be that you're a fabulous, innovative educator. Great. Go in that direction. It may be that you just want to be, and I don't mean this in a diminishing way. Your goal is to be an outstanding, efficient clinician who does groundbreaking clinical care. Fantastic. Put the ladder over there and help lead us in those directions. This is not a one-size-fits-all kind of phenomenon. So find where your ladder should be, figure out what the dose of scholarship is going to be, small, medium, or large, hopefully not zero, and then get that set up. And that means you have to prioritize and reprioritize your activities on a regular basis. You may think you have certain priorities today. Think about it again in 6 months, a year. Periodically reprioritize. And we do this every day in our personal lives, but we don't always do it in our professional lives. One of the reasons is because we feel like we're calendar victims. And I want to tell you not to be a calendar victim. I hope you could take this to heart, because the key is not to prioritize what's on your schedule. Here's my schedule. I got to get through all of this today, but to schedule your priorities. So if you want to write something, if you want to put together a grant, if you want to write a paper, if you want to put together a talk, if you're preparing your grand rounds, those preparatory activities should actually appear in a very intentional way on your schedule. When someone asks you to review a journal article, don't even think about accepting that review. Well, try to accept it if you can, especially if it comes from me. But don't even think about it until you look at your schedule and put the time on your schedule to do those activities. Be the master of your schedule, because you actually control 24 hours, 7 days a week, 52 weeks a year. And sometimes you don't feel like that. You feel like, oh, here's another meeting and I got to do this. But there should never be a day in your life where you say, I don't want to be doing what I'm doing. There's some days that are more fun than others. I get it. But you should be doing things that line up with where your ladder goes. So in a residency, in a faculty position, there are some things that you'll enjoy more. But if your overall life isn't running the way you want, you need to take control of that calendar. If you don't get home for dinner when you want to get home for dinner, you got to fix your calendar. Your calendar should reflect your priorities. Okay? And so you control that. You control the time. You know the old saying, how do you get something done? And it's ask a busy person. How do those busy people get it done? Is because they schedule their priorities, not the other way around. So take control of your schedule, take control of your calendar, make sure it reflects your priorities. Then you can focus on your efforts, prioritize the activities. And when you do this, you have to use the data from your life. So this is the first time that we've talked about data. Doctors seem to have a genetic defect in accurately assessing time. Have you ever met a surgeon who accurately assessed how long it took them to do a case? So by the clock, it took them 2 hours and 17 minutes. In their head, it took them an hour and a half, and that's what they're telling everybody. which makes for all kinds of scheduling problems, right? We think we'll be home by 7 o'clock, and you're calling from the hospital. It's 5 minutes to 7. It takes you 20 minutes to drive home. There is no way you can physically be home at 7 o'clock. And we say that because we want to be home at 7 o'clock or whatever time you pick. But be honest about that data. If it takes you 40 minutes to close your charts at the end of the clinic, figure out that in your time. But if you pretend that those things don't happen or don't take time, you can't get control of your schedule. So you have to be realistic about the data from your life. If you're always late and you want to stop always being late, you have to use the data from your life to get that figured out. And find a method that helps you keep track of the things that you want to do on a daily basis, a weekly basis, however you want to do it. And whether it's written or electronic, don't lose track of those things. So that's the only way you can keep your priorities squared away. And of course, because life changes, pandemics come and go, polar vortexes come and go, you'll have to reprioritize regularly. And that's part of this calendar mastery. This problem solving is important because we're often spending our days doing the wrong work, which means then we're doing work after work, like nights and weekends, and even on vacation. And it turns out you shouldn't be doing work on a vacation. You don't refresh yourself, you don't recover, you don't restore yourself, and it's a disservice to family and friends and those who love you and want to have a piece of you when you're on vacation. So you've got to find a way to make sure that these things can happen during your professional time. If you come home from a very busy day clinic, put the kids to bed, have dinner, and then get in your pajamas in front of the TV and have some epic time with your jammies for 2 or 3 hours, that's not a healthy habit. It just isn't. So you've got to learn habits like pre-charting and being able to close your charts the same day while you're in clinic. Things like that that sound unreachable, but are completely doable if you set your work up and your priorities in the right way. From the book, 7 Habits of Highly Effective People, this is a life-changing grid that I'd like you to all sear into your memory. It's just a 2x2 of important versus not important, and urgent versus not urgent. Very, very simple thing. Every part of our life fits into this grid. And let's look where scholarship might fit. So if we look at the things that are important, we want to spend most of our time on things that are important, but not urgent. Now, as clinicians, we have things that are important and urgent, right? Somebody's bleeding, somebody just collapsed, we got to run, leave this meeting, blah, blah, blah. Understood, absolutely. But scholarship shouldn't fit in that important and urgent. And what that means is the night before your presentation isn't the time to be putting your slides together, right? That should have happened a few days before, hopefully a week before, so you have a chance to mellow into your work and get comfortable with it. The grant application is due tomorrow, so why are you still writing tonight? Tonight you should be proofreading for the 3rd time. All that stuff should be in your timeline. So when you're working up against deadlines, it creates an urgency that's unnecessary with scholarship. We'll talk about how to set those timelines up. So I hope not important and urgent is rare in your life, and not important, not urgent, maybe sometimes, but really the sweet spot there is important things that aren't urgent. That's where you want to do those. If I can give an example from outside of scholarship, if you want to learn Portuguese, that's not urgent, probably not urgent. And if it's important to you, you got to spend some time on that. It should be appearing on your schedule, and it should be happening regularly in your life on a daily basis. If you want to learn it so that when you go to Portugal a year from now, you can't leave that to the last minute. You won't be able to learn it in the last week. Scholarship's the same way. It should just be regularly reoccurring, non-urgent activities in your life, so it's a steady build for your curiosity. You don't have to solve every problem to solve one. We're going to talk about what we know and why we should hold that very lightly so that we can be ready for our ideas to change and for things to be different. There's a fantastic new book that I would recommend. I actually recommend that you read everything Adam Grant reads and that you subscribe to his podcast called Work Life. His newest book is called Think Again. And the next two slides are some quotes from his book. I'm going to read this one to you because I know some of you are not following visually, but when people reflect on what it takes to be mentally fit, the first idea that comes to mind is usually intelligence. The smarter you are, the more complex problems you can solve, and the faster you can solve them. Intelligence is traditionally viewed as the ability to think and learn. Yet, in a turbulent world, there's another set of cognitive skills that might matter more: the ability to rethink and unlearn. And the key point here, speaking to an audience that's highly intelligent, recent experiments suggest that the smarter you are, the more you struggle to update your beliefs. And this may be why the progress of our science and the progress of our knowledge isn't going as quickly as possible, because we get entrenched in our beliefs. We don't rethink things and we don't update our beliefs. Adam Grant says the curse of knowledge is that it closes your mind to what you don't know. So while you're going through residency, you're just putting your head down and you're drinking from the fire hose. You're trying to get everything in there that you can. You really don't have a lot of time to question things. You're just trying to make sure that you'll be able to pass your board exams. You're just trying to absorb everything you can. You don't want to get any wrong answers. You don't want to color outside the lines. But once you get past that, it's really important to open your mind again. It'd be great if we could open minds during residency as well, because good judgment depends on having the skill and the will to open your mind. A hallmark of wisdom is knowing when it's a time to abandon some of the most cherished parts of your identity, why we do what we do. And if we don't have the guts to think things through again, we're going to be making the mistake of repeating the same things over and over and over again, even when we should have moved on. Speaking of moving on, there's a time to talk about persistence and there's a time to talk about letting go. So it's important to be persistent with your ideas. You've all heard of people who had an idea to do something. We are just finishing up Black History Month. Persistence is Martin Luther King. I just listened to the YouTube lullaby of MLK. If you haven't listened to that piece of music, you should. It's just beautiful. Just Google YouTube MLK lullaby. It's beautiful. He had the ideas, he had the dream, and he persisted. It was a big idea, and it has changed our world forever. Not to the degree it should change, but it's changing. Be persistent with the tasks. It takes at least 30 days to change a habit as an adult. It takes longer if you're making a big fundamental change. And it's good to start those by what we call stacking. If you're trying to develop a new habit, begin a new task, stack it with some other thing that's well established in your life. A simple example, I'm a vegan, so I take B12. And I don't have to take it every day. I take it the days I blow dry my hair. And so my B12 vitamins are sitting next to my blow dryer. That gets that job done. Then I don't forget to take it when I have it. You've heard of patients who need some kind of reminder to take their medicines, etc. But in scholarship, these kinds of things happen too. If you pick up tables of content from various journals, and that's a very simple way to stay updated. They're free. You can sign up. Make sure that you have a system for reading that and it just doesn't clog your inbox. Make sure that you have ways to be persistent in satiating your curiosity and engaging in scholarship. When it comes to applications for funding, everyone who has done this knows persistence is really, really essential. Surgeons especially, people in surgical disciplines, have a very, very high bailout rate. And they're not typically as persistent as they need to be to secure the funding they need to do. And once you go to the trouble to make an application for funding, you would never send it to just one place. We'll talk about that in a little bit more detail. And dissemination efforts. One thing I can tell you about me that Dr. Rice was kind enough not to share is I've probably had more journal rejection notices than any of you have. Okay, true, I may have more acceptance, but it's because I'm hitting the ball over the net. So I get the hits and I get the rejects. No problem. Doesn't bother me at all. Doesn't show up in my CV. Isn't that nice? But don't be afraid about that. Just put it in, put it in, put it in. Oops, sorry about that. We talked before about residency may not be the right time to find out what causes labor. So there's a right time to answer your question. You've got to have the resources. It's got to be feasible. It's got to have impact. So if you fall in love with your research idea and you bounce it off a few colleagues and everyone's like polite, oh, okay, that's nice. When they use the word nice a lot, move on. Okay, that's code for not so good. So you want to see people get really excited. You want to see them beginning to react like, oh, I understand. And that would let us do this. And that would let us do this. So it doesn't mean that your idea is bad. It may need to be reframed. There are no bad ideas, but you got to find the right time for the right idea with the right resources. You got to find that sweet spot. So don't give up. Keep hanging in there and find the time to do the ideas that are important to you. Very, very important. I wanted to talk about some tasks that are common in scholarship. Manuscript submission. A well-kept secret is that manuscripts don't write themselves. And one of the hardest things is to develop a system for manuscript writing. And whether you do it with a small team, very few people write solo manuscripts other than, say, editorials or commentaries, but find a way to do that so it can happen efficiently and that it shows up on your calendar as your writing time. And you'll learn what's your best writing time. Are you an early morning writer or an end of the day or middle of the night, whatever it is? When is your brain best for that? And you have to find a way to do that. So one of the things I recommend is when people begin to work on a project, they're already reviewing the literature, they're getting familiar with things. That's a great time to write your draft introduction for your manuscript. And as you plan the specifics of the project, I'm going to ask 10 women to do these research tasks and blah, 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 blah. Just write your methods. Okay, so now you have a draft intro, a draft methods, and you haven't done a thing on your project. You haven't started anything. There's no way you could send this manuscript in. You've got a few tables, maybe shell tables that are blank and empty because I'm going to say, was drug A better than drug B? And I need to know for these 3 or 4 variables. Okay, and it turns out now you haven't done any of your project yet, but your manuscripts actually have written. Isn't that amazing? Now when it comes, you're all done with your project, all you have to do is fill in that results, make a few comments in the discussion, clean it up, submit. Easy. So break this into doable chunks and get yourself into a habit of doing these kind of small tasks as you go along. Because if you sit down the night before you want to submit it and try to do all of it, it won't work well. You have to have some self-discipline, and you've got to know the difference between futility and persistence. So if it's 5 years and you're still submitting the same unchanged manuscript and you now have 100 rejections from journals and you don't even know, you're looking at engineering journals, that's futility. Stop, okay? But that you shouldn't dig a hole like that. And for people who write frequently, it gets easier with experience. When you're presenting or giving grand rounds or putting grant applications or writing manuscripts, it just gets easier as you do it over and over. So feel free to work with people who are comfortable with this project, comfortable with these kind of tasks. They can help you and show you one of the many, many good ways to get this done in your life. So funding applications is very, very important. You have to align your expectations. So it is an unreasonable expectation to put in your first R01 application at the NIH and expect to get funded. It happens, but that is like a case report in terms of funding. It just is very rare. So when you go for funding, it's very common that you have to apply and reapply and revise, etc. So don't have things right up against the wall. Remember, surgeons, Ob-Gyns have very high I give up rates. We send our first R01 in, they didn't even discuss it or didn't get a very good score. And we go home and we lick our wounds and we're terrible people and terrible doctors. And I'm never going to be as good as Dr. So-and-so. And oh, woe is me. Stop, right? Just hit the ball over the net again. Send it back in. Learn from the experience. Make the grant application better. Take things seriously, think again, and send it back in, okay? Don't bail. You're a wonderful person. You're a smart person. And again, I have more grant rejections than probably anyone else on this call, and I have good grant funding. You just hit the ball over the net. So sometimes it hits, sometimes it's not. Coming from Chicago, I use the example of Michael Jordan. He missed more shots than probably anyone else in the NBA at the peak of his career, and he made more because he just shot the ball more. So just keep sending it over the net or into the hoop. So dissemination efforts, it's important to track the activities where you are, expect rejection. So you sent it to your journal A, make sure, give yourself a 24-hour mourning period, I say. All right, darn, they didn't take it. And then have your plan B ready and turn it around quickly. It for sure will not be considered for submission when it's on your computer. It needs to be sent back to the journal. So turn it around quickly, hit the ball back over the net, but carefully, responsibly, and quickly, not carelessly. As a journal editor, I see some very careless resubmissions. Sometimes they come back quickly, sometimes they come back slowly, but make sure that you do it with care. And if people have specific questions about that, I'm happy to address that. I also want to take some time to talk about skill development. It's important that we never stop learning. It's really important that we never use the words like, I'm a little too old to say I couldn't do that. I'm not sure that being old makes it hard to learn new things. There's things we learn easier when we're younger, but there's no reason that just because we hit a certain age, we can no longer learn. So there's some things that are easy. There's some things that we need to learn. So people had to learn the EMR. People are going to have to learn new methods of other techniques as well. I learned how to give a COVID injection this year. Go figure, right? I think it's better if the nurses do it. They were much better at it than I was, but all hands on deck in a pandemic. But try to learn something new regularly. We all have gotten better with Zoom. Some people can do virtual backgrounds really easily. This kind of presenting, I hope I'm doing okay. It's this new skill that I'm trying to learn to be an effective presenter on skill. And just try not to say it's ever like, don't say it's too hard or I don't think I could do that. You're pretty smart people. So it's a matter of dedicating the time and the will. So one of the things I have in my own personal and professional life is to try to learn a new software. Last year I learned Mendeley for referencing. And that came in handy this year. So I could do some of my own referencing as I prepared some articles for submission. And you can do micro lessons and trade with people. So you teach somebody that something. Some things are very easy for me. I can teach someone that, and they can teach me something. I had to become facile with Twitter, for example. That's not something that I expected to learn. Now I'm learning Instagram, and I'm going to learn Instagram TV. Okay, whatever. That was not on my list a year ago, but it is this year. So we can all learn, and I learn from others who are very good at these skills. And then in exchange, I teach them some of the things that I've become proficient at. So try not to adopt that mindset of, oh, I don't think I could ever do that, or I'm too busy, or I don't want to do it. If it's something you want to do, make sure you're learning something fresh each year. I really strongly recommend that whatever dose of scholarship you want in your life, that you keep a close relationship with your library team. They can help you get very savvy with searching well beyond PubMed, and that you know how to use at least one citation manager. It's not that hard. If I can do it, anyone can do it. I'm currently using Mendeley. I know a lot of people use EndNotes or RefWorks. It's just not that hard, and it really, really helps keep track of your library. The days of paper copies of files in file cabinets or in the back of your credentials in the office, those days are over. If you haven't left that era, it's time to seriously consider doing that in 2021. It's a more online world. And so learning to keep your PDFs in an organized way, being able to pull those abstracts really helps you with your scholarship. Not everyone knows about Jane, which is the journal author name estimator. This is the link for this. And this can help you match the manuscript that you want to submit to a journal. They suggest journals that might be a good match for your work. And librarians are very familiar with this, but it will, you put in your keywords, your topics, and it'll tell you, 7, 10 journals that you might want to consider. And then of course it's your job to kind of sort through those. But this is a very handy little tool that a lot of people don't know that helps them with their scholarship. I want to just show a couple slides about project management. Project management is pretty important when you're leading a team. you have to be realistic about timelines and accountability. And there's really a problem when you join a group, you say, I'm going to do this for this writing group, or I'm going to do this for this research group, and you don't follow through. Now, all of us have been in situations where we intended to do something and life circumstances have changed. And as long as we communicate that to our colleagues, I had promised to do X, Y, or Z. I'm so sorry, I won't be able to do that. I have to withdraw, or I have to delay the activity until such and such. Team members, is this okay? As long as you're in communication with people, there's health issues, family issues, whatever. As long as you're accountable, that's fine. But the worst thing to do is everybody else, people used to write books together, and then the one person who was supposed to write a chapter just didn't come through, and the book sat and everybody's work got old for a year until the last person came through. That's the opposite of how to make friends and influence people. So don't be that person. Make sure you schedule your time to meet the commitments that you've made. And if you really want to make friends, come in early with whatever you're going to do. Try to do more and try to do it early. Of course, you make adjustments, and never, never forget to celebrate. Someone's got their paper done, someone's got their project done. I would love to be there celebrating the 4 residents who did their work today. And I'm looking forward to their presentations so we can at least celebrate by Zoom today. This is an example of a project timeline for a funded grant. So you have to think of all the steps. This is just an example. There's nothing magical in this. But if you work backward, if I know that June 19th is the day that the submission has to go in, look what we have in this timeline. 2 days before is the day we submit. Now, why do we do that? And this is the 11th commandment, is like stuff happens, right? Stuff happens. The IT goes down, the internet, something this, blah, blah, blah. Somebody forgot to do something. And so you have some buffer. Don't plan to submit at 11:59 p.m. in the time zone. You'll forget your login, the password got blocked, blah, blah, blah. There's no one to talk to. So just step away from the deadline. Step away from the deadline. You can see for about 8 days prior to that, there's an internal review required, at least at our university, and this is common, that there needs to be an internal review. So you have to be done on June 5th. So your work, look at June 5th to June 19th. Look at that buffer, how far you've stepped away from the deadline. Now that's not a problem, because what we've done is in those 2 rows at the top, we've put in all the things that have to happen before we put this grant in. And we put them in order of what are the quick and easy things, what takes more time, etc. So this is just an example, but I encourage you to make a project timeline when you're doing this, especially if you're working with other people and you depend on their input. So anything that depends on other people, put that early in your timeline. Ryan would like to annotate. Okay. I don't know.
No, I wouldn't. I'm pushing the wrong button.
Okay. I'm learning. I don't know what to do, and I can't advance my slides now. So we may need to get out of that annotation zone. There we go. So this is a similar timeline for group writing. So this manuscript was going to go in on the 27th. And this is a group writing project, so that everybody at the beginning of the project, we put together a timeline like this so that everybody knows to block time on their schedule to do their reviews, to send in their edits, when they can expect the next version, etc., etc. And then the manuscript gets in at the time that the group is agreed. So you can see over 3 months, this went from nothing to a final submission. And then, of course, after this timeline, there would be time for revision. So I really, really strongly encourage that you set this timeline and then block time in your calendars to do the work that you've committed to. Oh yeah, then came COVID, right? So all this sounds good, except that now COVID is here. We were exhausted before, and now we're ultra exhausted. And you just cannot imagine that this person here is talking about scholarship on top of all the things we already have to do. And that's why people feel like they're burning out. Our candle has gone out. They got work. Oh yeah, they got to earn all those RVUs. Oh my gosh, if we get one more RVU report about this or that, and now they changed the RVUs, we got to make sure our packet's ready for promotion and make sure we're teaching. Our teaching evaluations make all the difference. Make sure you get some research project done, help a resident, and we got to do service in the university. People are exhausted and fried, and we can do something about that. But right now, for some people, work has become an intolerable burden. It's not a source of purpose and meaning like our vocation should be. It's a crisis of meaning, a loss of resilience, a loss of our community. And what it leads to is a slow, relentless deterioration of values, dignity, spirit, and our will. And some of you that I'm talking to now know exactly what I'm talking about. You're feeling it very strongly, but I'm happy to know that you're in a community of people who care about you and something can be done. We know that the more functionalities that are added to the EMR, the worse the burnout comes. We're doing a lot of documentation that does not have physicians working at the top of their license. And this is a systems issue. This is not an individual failure by any of us. And this is something that needs to be addressed. This is a significant contributor to how many of us are feeling burned out. So if we look on the left here, the symptoms of burnout, and some people don't like that term burnout because it reflects on the individual, but it's that moral distress that people feel that they're not getting the joy from their profession in medicine. They feel withdrawn, defeated. They feel like they're just going through the motions. They get very brittle and rigid in their personality, and this is a risk factor for this problem. They get pretty cynical and hopeless. They use the they language a lot. They make us do this, they do this, and they assume a kind of this victim mentality. They become hypercritical. Nobody can do anything good enough, fast enough. They're ineffective. They feel like hopeless. Why should I even bother to try? I'm just treading water here. And they're very, very resistant to any change. They assume any proposed change will be a problem, when in fact, change can be helpful. If you can get over to the resilient side where you're fully present, you're engaged, doesn't mean you have to love everything that's going on or feel like there's nothing that could be better, but the reality is what it is. So if you can accept today's reality and be present, you have a chance of bouncing back, feeling engaged, bending, not breaking, having a capacity for positivity, which doesn't mean you turn into Pollyanna, but you can become stronger, move forward, and evaluate and welcome change appropriately. So for all of us, as we try to find the right dose of scholarship in our life, whether we keep the dose very small, medium, large, or jumbo, there's no right answer. You have to find what's right for you. But I hope that everyday scholarship is part of your life, and that the main thing is to keep the main thing in your life. So I hope that I've shared some encouraging words so that with our goals for scholarship, you can burn bright and pass this on. And I look forward to questions and discussions. Thank you all very much.
Linda, that was fantastic. I feel like you were just speaking to me. That's a little scary, but every aspect of your talk resonates with me. And I think it's this thing about what gestational age everyone on the call is. It's relevant to every single person on this call, and I can't thank you enough. Now, I want to check the chats to see what people are. I've been getting a lot that they're just loving this talk. I'm wondering if folks have any questions. I think it may be more about pondering than questions. You gave us a lot to think about here.
Well, you guys are smart. I wasn't going to give you the beginner talk, you know.
Well, I'm thinking about how this COVID thing has, and I'm sure it's the same for every single person on this call and probably on the planet, but I do think that healthcare providers are more, intimately affected by this situation for a variety of reasons. I don't know, maybe that's narrow-minded, but, I think looking for that light at the end of the tunnel with COVID will help. And then I'm happy to say that several people in the department are working on improving the, electronic medical record from the highest level, which is just, it's a Sisyphus-like job, but I agree with you that it's worth the effort. Constant, unrelenting pressure. So, Dobie's got a question. Dobes?
It's actually Heidi on Toby's computer. Thank you so much again, Dr. Brubaker. You are inspiring as always. Can you offer some advice to those of us who might have so much in our schedules right now that we can't keep the main thing, and how you strategically and without losing face sort of reprioritize?
Different techniques can be used, Heidi, and thank you for thinking about this because it's a common problem. So one of the first things I think is important to do is make sure that the activities you're doing line up with when your brain is best for those activities. And everybody knows there's some things they can do on autopilot. They can, multitask. It doesn't really take as much attention, although multitasking is not recommended. Doesn't require your best brain. But there are some things that go much better when you're in your best brain mode. And so for most people, writing is a best brain activity. And different people have their best brain activity at different times of the day. It's just how we're wired. So if you can figure out when your best brain activity is and line those activities with that lets those things get done more efficiently. And then I would recommend that you create a calendar without trying to account for the status quo. Just start with a blank piece and say, here's what I want. Here's where my ladder is going to take me. Here's what my day should be. And then look at the status quo and see if you're able to reconcile and bring to a middle ground. You can't go from today's status quo to like perfect what I want tomorrow. There's realities. You can't. If you don't have funding to cover more research time, you can't. We understand that reality. But there's a plan to get from current status quo to the desired and you should do that with really strong intentionality. Yeah. Heidi, do you know when your best brain time is? Do you know when your best brain time is?
Yeah, my best brain time is now.
Now.
5 to 9 a.m. is my writing grant time and manuscript writing time.
Yeah. So I would protect that and try not to do mundane things during that time. There's a time and a place for, like, I would not check your email before you start. I would not check your email till 9 o'clock when you're done. I would really let your brain fire.
And I think we have Ellen, you got a question?
Thank you so much, Dr. Brubaker. My question is I think maybe a little bit tied to Heidi's. I think one of the things that's difficult for early career faculty is to learn exactly what you said. Okay, what's my passion? What do I want to do with my time? But once they figure that out, the negotiating that with their division director, everybody's on a ladder to gain the skills and get their boards. But once they hit that point where their schedule doesn't fit where their heart is or where their ladder wants, where they want to put their ladder, how do they negotiate that with their division director with the demands of clinical time, which will basically metastasize and take up every moment of every day? How do they negotiate that? How do they get disentangled from the clinical care and the compensation quagmire?
So it's a great question, and it's not one that I have a simple answer for. I think one of the first keys is to learn to RVU efficiently. So when you're RVUing, be very good. Make sure you code well, you close your chart. Don't spend any more time RVUing than you need to. Know what you need to do to meet your requirements for your salary, and learn to do that. Get very good at that. Get very efficient. So if you RVU poorly, you go through the day slowly, you're not efficient in the clinic, you don't close charts as you go. Now you've got 4 hours of charts when you're tired, which takes longer. You've just chewed up a whole bunch of calendar time. So learn to RVU efficiently. That's one of my first keys. And then get the RVU monster into the hours that it fits, not in your prime brain time where you need to do these other scholarly activities that you want to do. So how to negotiate is creatively. So to find a sweet spot that works for the division director and the faculty member where each give a little, but there's clear goals and metrics for advancement so that that person's climbing up the ladder and the division director is assured that it's up against the right wall. So a recommendation for faculty member is not just to show up to the division director or the chair and say, I need more protected time. Not going to happen. Okay. What does work is say, I would like to accomplish these things. And the reason I'd like to accomplish these things is blah, blah, blah. In order to accomplish these things, these are the steps I need to do. Here's your 1, here's your 3, here's your 5. With your permission and your support, I'd like to do these changes in order to get to this goal. Would you be willing to support this? And that's how the negotiation starts. But that word, I'd like more protected time, is code for pay me for doing nothing. And that will not work. Okay. You protect your time. The faculty member protects their time. And people are willing to invest in you when you have a clear vision and they see progress. So you can say, I'd like to climb this ladder over here. I need this support. And at the end of 3 months, 6 months, 1 year, I'll have these deliverables, at which point I would like this additional support, at which point I'll have additional requests for support. And everybody's got some skin in the game. It works much better that way, in my opinion. Ellen, have you had experience or do you feel differently?
I think you just said that in a way that's more eloquent than anyone I've ever heard. But I absolutely agree that idea of protected time has to come from within. The system can't protect you from yourself and your time. So I think there's give and take on both sides, but I do think trying to figure that out, how am I going to use my time? Where do I want to put my talents? Where do I want to put my energy for the course of my career? That comes from within. So
Yeah.
Great advice.
Thank you. And for residents, think of residency as like a buffet. Try all these different things, like just like a buffet. Just leave the plate on the table. You don't have to eat the whole thing. Just if you tried this and you don't like it, and you tried this kind of research, you don't like mice, you don't like petri dishes, don't do that kind of research. But that doesn't mean all research is bad. There's wonderful options in all these kind of different areas. So use research as a way to try things without feeling like this is my forever life. Try it. If you don't like it, move on to something else. That's what residency is all about.